The question of what goes on in the human body at the cellular level is certainly a fascinating one, and no area of research is quite as intriguing as reproductive medicine. Doctors are now able not only to help women who've had difficulty becoming pregnant to conceive, but also to give them more knowledge than ever before about what their baby might be like. Let's go inside the Southern California Reproductive Center in Beverly Hills to hear from Dr. Mark Surrey.
You know, the advent of what we call test tube babies, which is actually in vitro fertilization, that technology really has revolutionized the treatment of patients who are infertile, in so much as that it's the first time that we've actually been able to observe what the human egg appears to be like, how it behaves when exposed to the male gamete, the sperm, and then what happens in human embryology that causes cells to divide. And this is what's basic to our reproductive potential, in that if cells divide normally, then we can create normal embryos. Normal embryos can create normal pregnancies. If cells don't divide normally, then that doesn't happen. So initially, the process of in vitro fertilization was thought to be restricted to women whose transport function, the fallopian tubes, were not working adequately, and therefore it was a way to bypass that. And that's definitely true, and it still remains a truism. But the function of the process of in vitro fertilization is now applicable to so many other forms of patient problems, ranging from problems with the male to people who have different types of genetic or inheritable problems, either based upon advanced age or things like that, where we can actually biopsy and tell an embryo's content before we put it back. And the laboratory environment that we've been able to create for this process has improved so much in the last couple of decades that it works much better now than we do. As the process has evolved and as the efficiency with which we do it evolves, the success rates increase dramatically. And as the success rates increase, it alters how we treat patients. The efficiency with which it works, the results are so good now that it has been transformed from what a lot of people used to feel as a last resort after medical and surgical therapies didn't work, to now almost a first line of therapy where it can be offered to patients much earlier in the process. Our knowledge of the process has changed dramatically. For example, 25 years ago, we used to remove eggs by laparoscopy, which is a surgical procedure. Now we remove them by ultrasound, which is a non-surgical procedure, so the process is much easier. The laboratory portion of the procedure is much more efficient and effective now. We used to want to get the embryos and the gametes out of the laboratory as quickly as possible. Now we like them to stay in the laboratory as long as possible to encourage their development and growth. We used to keep people in the hospital for days afterwards at bed rest. Now people go home in 15 minutes. So the whole process has become more effective, more efficient, and easier.